Magandang gabi mga kaibigan. Welcome po dito sa ating palatuntunang Radyo Klinika sa DWIZ. Ngayong gabi po makakasama po natin isang napakagaling na pediacardiologist mula po sa Philippine General Hospital. Wala po iba kundi si Dr. Jonas Del Rosario. Doc, magandang gabi sa iyo.
Magandang gabi sa inyo.
Opo. Doc, kumusta naman po dyan sa Philippine General Hospital now that it has turned na bilang COVID-19 na center?
Okay pa naman po kami. This is
Mm.
day 6 of us being a COVID-19 referral hospital.
Mm.
Yung Philippine General Hospital po ay tumatanggap ng mga pasyenteng may COVID-19.
Mm.
We get referrals from the different hospitals,
Mm.
mostly coming from Metro Manila.
Mm. Lahat po ba ng may COVID-19 ay tinatanggap po sa PGH o meron pong mga depende po sa kanilang mga simptomas?
Actually, ang tinatanggap po namin ay yung mga positive for COVID-19 na
Mm.
moderate to severe ang kanilang condition. Yung
Mm.
mga mild po sana hindi namin yan ina-admit. Usually yan ay napapauwi para or obserbahan lang.
Mm. Tapos sa bahay na lang po muna sila magko-quarantine, gano'n po ba? So mga s
Well,
mm.
depende po, kasi kung sila ay wala naman tutuluyan sa bahay
Mm.
na ma-isolate yan ang sarili nila, hindi rin namin sila pauuwiin kung positive na sila. Baka
Mm.
ma-admit din or at least ilipat namin sa ibang ospital.
Oo. So may mga stages ba ng simptomas din na tinitingnan bago tuluyang ma-admit po sa PGH?
Yeah, kasi usually nag-uumpisa yung COVID-19, mild pa lang yung symptoms usually.
Mm.
Makati yung lalamunan, dry cough,
Mm.
tapos nilalagnat ng kaunti. So yun, mild pa lang, ano. Tapos
Mm.
most of the time, sila ay nasa swab. Chine-check
Yeah.
muna, magsasabit sila ng specimen.
Mm.
That may take a while because the test results do not come back right away.
Mm.
Now, we observe them. So pag ganon, ano pa lang sila, tinatawag nating PUI,
Yeah.
Persons Under Investigation. They have the symptoms, but they are not yet confirmed to be COVID-19 positive. So yung tapos, yung progression nun, when they start complaining na nahihirapan na huminga, bumibilis na yung kanilang respiratory rate, kinakapos na sila ng hininga, medyo bumababa na yung oxygen level. Yan, moderate. And then kapag x-ray, minsan makikita mo na sa x-ray, meron ng tinatawag na infiltrates or signs of pneumonia. Lalo pa siya papunta sa nagpo-progress. At kapag kailangan niya, sobrang hirap na siya huminga, to a point na kailangan niya ma-intubate, yan ay severe na.
Mm. Okay. Ang testing din po diyan sa PGH ginagawa, diyan may laboratory din kayo to test the kits?
Yes, meron na
Mm.
kaming test kits. We swab them, we submit them to the UPNIH
Mm. Mm.
na
Okay.
malapit sa PGH.
So gaano karami pong pasyente ang puwedeng ma-accommodate ng UP-PGH for COVID-19?
Yeah, we have 130 beds allotted
Mm.
to COVID-19. Right now, we have about 54 COVID-19 positive and 12 PUIs. Ano? Meron pa kaming mga PUIs, hindi yung mga pasyente namin na hindi
Mm.
pa na results but moderately severely ill.
Mm. Okay. Mga ilang doktor po ang nag-a-attend sa isang COVID-19 positive patient?
Ah, meron kasi kaming private and charity ward. But more or less, kapag ikaw ay merong COVID-19, at least merong isang nakatutok na doktor sa iyo, no? Monitor ka. Tapos ano yan 8-hour shifts, no? So at any one time, you will probably get seen by a doctor 3 times, no?
Mm.
3 different doctors.
Mm.
So ang ginagawa, team, kaya minsan hindi naman kailangan isang doktor bawat isang pasyente. So para hindi na so a team of doctors try to cover for everyone.
Mm.
Uh, Sa ngayon po, meron kaming at any one time during the day, may mga 500 healthcare workers kami, doctors and nurses combined, operating or working in this COVID-19 referral center.
Mm. Okay, Doc, I saw your plea, no, yung panawagan mo sa publiko, lalo na doon sa mga naka-recover na sa COVID-19 para i-donate yung kanilang mga dugo. Ano ang reason for this?
Okay, ito po ay isang panawagan sa mga naka-recover na for COVID-19 kasi po yung dugo nila, kapag ikaw ay naka-recover na, meron ka ng antibodies na na-develop against that illness. No? So kung presumably kung ikaw ay dating COVID-19 positive at naka-recover ka, na pauwi ka o na-discharge ka, at pag inulit ang test, ikaw ay COVID-19 negative na, ibig sabihin na eliminate mo na yung virus sa katawan mo. At makikita rin sa dugo na meron kang antibodies. So yung antibodies na yon ang gagamitin na yung antibodies sa dugo.
Mm.
Itatransfuse naman namin sa mga
Ta-transfuse, oo.
na
Oo.
hindi pa nakaka-cover, lalo na yung mga severely ill. So,
Oo.
yan ang basis niya, no? We will transfer the antibodies of those who were able to survive the illness and give it to someone who is still trying to fight that disease.
Oo, parang PRP, ganun ba yung treatment na mangyayari, Doc?
Kasi ano yan plasma actually ang ikukunin namin, no? Yung liquid part ng dugo, that is the one that you see the antibody.
Okay. Pero kailangan mag-match yung dugo nung COVID-19 na positive na nag-recover doon sa pasyente na bibigyan ng kanyang dugo. Ganun po ba?
Yeah, meron na
May matching na
Hindi
dapat
ka-
na mangyari.
Hindi
Oo.
simple na kuha lang ng dugo, ibibigay na.
Oo.
So, i-screen yan as if like you are donating blood.
Oo.
So, may screening even for the donors. Siyempre, titignan kung ikaw ay talagang ideal donor. That means wala kang sakit na can be a contraindication for donation like hepatitis, HIV, syphilis, malaria. So, they go through the same strict clearing or clearance, or parang meron yan muna, no, just to make sure that you are a good donor. At the same time, actually, yung mga donors, we have to make sure na talagang naka-recover na sila sa sakit, no. Usually, we check that they do not have any more signs and symptoms of the illness. So wala na dapat fever, cough, cold, they feel very good, they're very strong, ambulatory, and then definitely their blood should be negative already for the virus. So dapat COVID-19 negative. And usually, from the time they are tested negative, negative yung test, 2 weeks pa bago talaga siya i-enroll for possible blood donation.
Dapat
And
ba
there's a
dalawang beses na negative o kahit isang beses lang na negative siya, pwede na siyang maging donor?
at least isang beses na negative, no?
Okay.
But
Oo.
we will probably have patients na dalawang beses na negative. But at least one na negative. Oo. Na
Mm-mm.
kasi kung isang negative pero wala ka na namang nararamdaman, most likely
Wala na
okay.
talaga yung virus. Pero Doc, papaano, may mga lumapit na ba sa inyo ngayon na after your plea, after, makalipas sa
since-
inyong panawagan? Oo.
May mga tumawag na po kasi
Wow.
may hot number. Wala lang, hindi ko lang hawak ngayon, but I will give it to you at
Pero
ikaw na lang ang
marami na?
meron.
Oo.
So far, I was told that there are about 30
Wow.
30 patients who are willing to donate, but we have to screen them. Oo. So yun, nakakatuwa. Actually, sabi nga sa akin, dapat daw pumunta ako sa RITM dahil dun sa RITM may listahan sila ng mga naging positive. So at least alam natin, 'di ba? Tapos and maybe I should ask the hospitals to tell me kasi may data privacy rin in a way, no? It will be nice to track those who were able to go home, 'di ba? And but we are making this appeal publicly, so hopefully marinig nila ito, and through your station and other TV and radio stations, sort of like asking for help.
Yes, oo.
Yun.
Talagang magtutulungan tayo dito, Doc. Pero ang PGH lang ba ang gumagawa nito? Na transfusion of blood of the COVID-19 positive recovered patients?
St. Luke's Global yata ay gagawin na nila, narinig ko yan. So that's good. It doesn't have to be just one hospital, no? Tapos, ano pa ba importanteng sabihin?
Pero
Yan,
kayo ang nag-initiate niyan, Doc, sa PGH?
hindi ko kasi alam siguro kasi this is a experimental study para tong compassionate use, no, because this is not FDA approved. Although there are some countries using this now, it has been done in the past, in previous epidemics like the H1N1 influenza virus,
yes,
the
yes.
MERS-CoV virus, the SARS.
So hindi na
because
pala
the-
bago ito, no? Oo.
Hindi na. But now, this is new because this is the first time we will be using it, at least in the Philippines. First time to use it in COVID-19, no, against the novel coronavirus.
Have you tried it already on a patient?
Wala pa. So
Ah.
it's all, we still have to screen them. So hopefully by next week, meron na kaming mabigyan. No?
Okay. Yung pong mga COVID-19 patient po dyan sa PGH, puro po ba may mga comorbidities at saka puro po ba matatanda or may mga bata rin po at wala namang comorbidity?
Merong mga bata na walang comorbidity, no? Meron ding, so it's a toss-up. Usually pag mga 50 and above, may konting hypertension, yung iba may diabetes.
Yeah.
Yung less than 50, usually wala. So, and as you know, if you are elder, if you have a comorbidity, that's a risk factor for that disease. No?
Oo.
It's a poor risk factor. So, minsan po, kahit na mild lang yung symptoms, but they have comorbidity, lalo na diabetes and hypertension and asthma, we admit them na rin kasi these are the ones who can deteriorate fast. No? They present to you as mild, but in a few days, they will deteriorate and you have to be ready to treat them right away.
Pero yung transfusion po, gagawin nyo lang ba ito dun sa mga healthier COVID-19 patients or will you try this also doon po sa elderly at merong comorbidity?
No, we will actually give it to those who are severely ill, and these are usually the ones with comorbidities.
Okay. And kailan nyo po umpisahan ang inyo pong pagbibigay nito, Doc?
Once we have the right donor and we have a recipient, no? Actually, may mga ilang pasyente na kaming nasa PGH na guarded ang condition and they will benefit from it. So that's why we're trying to get the system going and we can start screening, no? So we just want to be strict as much as possible kasi meron ding side effects yung transfusion, but we just want to make sure that we have the right donor.
Ano yung mga side effects, Doc?
Usually, mga transfusion reaction, no? Siyempre, although kahit sabihin mo na minamatch mo sila, minsan meron pa din yan. There is also this theoretical effect na sabi, yung daw makakatanggap noon for a while, you will be suppressing their immune system. Ironically, you're giving them antibodies to fight for the disease, but you're sort of like blunting their immune response in a way. Siguro kasi binigyan mo sila ng ibang immune but that's transient, no? We still feel that the benefit of getting the transfusion the benefit is much more than the risk or the complication.
Okay, Doc, so kung gusto po nilang lumapit po sa inyo, nag-recover mula sa COVID-19, they just have to call PGH, tama po ba?
Tama. Philippine General Hospital. I don't have there is a number actually. I will just probably give
Nandun
it
sa
to
ano
you.
mo naman yun, Facebook page mo yun, Doc, ano?
No, nandun
i-check ko,
nandun sa infographic po.
Oo.
There is a person that they have to call. That's the hotline number for this call for donation.
So while
We call this therapy.
while I'm looking for it, Doc, ano ang sa tingin mo, dapat na ba nating i-lift ang ECQ?
Hanggang kailan, di ba April 12 ang ano?
Yes.
Yeah. I am hoping na bumaba na, no? Although, today when I look, ito raw yung increase, not as much as yesterday. So hopefully, mag-continue yung trend, no? But I'm not so sure because we will be, this is the, now that we have the testing kits, we have more testing kits and there are more labs that are approved. That means more people will be tested. Baka magulat tayo, mas marami talaga pang positive, eh, no? So, I cannot really commit. I think at this time, it's so premature to say, okay, hanggang sa 12 na lang, no? It really depends. If it's really spiking, if it's still like going up, that I think we have to delay we have to continue and extend the enhanced community quarantine.
So what can you advise sa mga tao pong nakikinig, nanonood sa atin ngayon para maiwasan pa po yung paglaganap nitong COVID-19?
We're doing a good job. Tuloy muna po natin yung social distancing. I know mahirap po. We need patience, no? This is for us. Actually, talagang malaking tulong po kapag nabawasan yung social interaction because you try to contain the transmission.
Yeah, yeah.
And then, so yun po, kailangan po natin na maging pasensya muna po dahil I'm sure people would like to go back to their usual lives, no? But the repercussion will be very bad if suddenly there is a surge of COVID-19. Hindi po kaya ng healthcare system natin, eh. Talagang pag na-overload po ang mga hospital, nako, hindi natin alam kung saan tayo pupulutin, no? So, sa ngayon po, medyo manageable pa dahil parang kahit papano, hindi naman natin na-overwhelm, although may mga ibang hospital na medyo nagsasara na nga sa COVID-19. So, I think patience ang importante. Yan ang magagawa ng mga ordinary or at least yung mga nasa bahay. Sabi nga namin, you help us. Actually, the frontliners really, or the first line of defense is the community, eh. Diyan eh. Nandyan ang talagang containment. Nandyan. Kapag na-contain na effectively na-prevent yung transmission, then that's good. The last line of defense is the hospital.
Yeah, yeah.
We don't want that na sana wag na umabot sa hospital. Doon pa na sa barangay level. Na-contain na natin yun.
Pero, Doc, dyan sa PGH, nabanggit mo may charity patients kayo. So, ibig sabihin, meron din talagang mahihirap o mga informal settlers na nagkakaroon ng COVID-19. Kasi yung parang kumakalat ngayon sa internet, pag daw nasa mahirap daw, hindi raw tinatamaan, mas malakas daw immune system nila. Totoo ba yun, Doc?
Hindi. I think nangyari lang po na kasi naunang matest yung mga yung testing po kasi
Yung mga
available
nag-travel, oo, sila yung unang
private
na-test.
hospitals. Yung mga nakapag-travel po, syempre medyo may kaya sa buhay. Pero may local transmission na po eh. So syempre kakalat na yan. So definitely po hindi po sakit ng mayaman yung COVID-19. Wala pong pinipili. And that's the reason why the DOH hospital, the Department of Health hospitals are also getting patients, no? And PGH is not an exception where we were asked to be a COVID referral center because we are expecting that we will be catering to the indigent patients. No?
At saka yung isa pa, Doc, yung sinabi rin na kapag daw COVID-19 patient ka, ay yung nga, dapat layuan ka, wag kang kausapin. Kasi daw, totoo ba yun na kahit daw sa simpleng pakikipag-usap, ay pwedeng matransfer yung kanilang virus?
Right na may mga pinakita yung Japanese doctors how just simple talk na talking, yung laway mo parang nagpo-float doon kaya minsan nakakatakot din. And so that's the reason why now people are being asked to wear a mask all the time, no?
Yeah.
At least kung meron kang kahalubilo, mag-mask ka na lang, hindi ba? Kung lalabas ka, mag-mask ka na lang. I believe in that principle na mag-mask na lang. Unless you're by yourself, nasa bahay ka na. But if you are talking very closely, I think it's prudent to wear a mask. No, some countries said that that's the difference of their country compared to others who really had it bad. No, kasi yung mga ibang countries, talagang they were strict with wearing a mask.
Dapat ba talaga yung mask na face mask ang isusuot o pwedeng kahit do it yourself, mga panyo, makakaprotekta na ba sa'yo yan against COVID?
Sa tingin ko po, yung ordinary mask, kahit yung cloth, naglalakad ka sa kalye, okay na yan, no?
Mm.
It will be, the surgical mask is important if you are in a hospital,
Okay.
or you're a health worker taking care of patients. So, and then of course, there is this N95 mask. Yun talagang yung mga frontliners na natin that they're doing dangerous procedures that will expose them to COVID-19. But for an ordinary person walking in the street, at least have a mask, a cloth mask will be okay, no?
Okay. Anyway, Doc, ito pala yung number, no, para doon sa mga COVID-19 survivors na kung maaari po ay makipag-ugnayan sa Philippine General Hospital. Ang number po ay 0917-805-3207. 0917-805-3207. Ang hahanapin po si Dr. Sandy Maganito. Tama po,
Yes,
Doc? Oo.
tama, Dr. Sandy, tama.
Oo. So, i-donate po ang inyong dugo. Maaari po kayo makatulong sa mga pasyente pong may COVID-19 po sa kasalukuyan. So, punong-puno na po ang PGH ngayon, Doc.
Well, we are 60% occupancy, although marami na nagre-refer, no? So, we're 130 beds for this COVID-19.
Mm-mm.
At kung kailangan talaga, baka ma-extend pa ng konti. Kung talagang tumaas, meron pa kaming buffer beds to increase, no?
Mm-mm.
Ano po, ang isang mahirap sa COVID-19 facility, yung dapat you have a stable workforce kasi talagang minsan may mga tao ka, doktor, nurse, nagkakasakit. So kailangan meron kang substitute o meron kang reserve force. So actually humihingi rin po kami ng mga volunteers na doctors and nurses. Kasi kumbaga sa troops ng army,
Yeah.
pag nalagasan ka, kailangan may kapalit.
Mm-mm.
Oo.
Okay. Anyway, Doc, thank you so much again and thank you so much for your service. Maraming salamat, Dr. Jonas De Rosario.
Salamat po sa pagkakataon at magandang gabi po.
Opo. At sana nga po dumami ang mag-donate po ng dugo. Balitaan nyo kami, Doc, kung ano ang mangyayari sa inyong mga
Sige,
unang bibigyan.
sasabihan kita pag meron na kaming unang pasyente.
Yes, oo. Thank you so much and hoping for your success. Maraming salamat. You are heaven sent, Dr. Jonas De Rosario.
Salamat.
Okay. Yan po si Dr. Jonas Del Rosario ng Philippine General Hospital. Okay mga kaibigan, para po lumakas ang ating immune system, of course, syempre, kailangan tayo po ay mag-Masumax Food Supplement. Ayan. Ang Masumax Food Supplement po ay may 8 super mushrooms, may royal jelly, American ginseng. Available po yan sa lahat ng Mercury Drugstores nationwide. 25 pesos lang po per capsule. Kung may mga tanong pa po kayo sa Masumax, pwede po kayong magtanong po sa kanila sa 0925-627-8629 o kaya pumunta sa kanilang Facebook page, Masumax Face Food Supplement. Ito po yung itsura nung kanya pong capsule, no? Yan ang Masumax Food Supplement. And of course, iwas sa sakit. Napaka-importante na tayo po ay umiwas sa sakit sa pamamagitan naman ng MX3. Ang MX3 po, it comes in tea, meron din po siyang coffee, at gayon din, meron din capsule form ang MX3. Iwas sa sakit kayong pong panahon ng COVID-19. At tayo po ay magpapaalala muna mga kaibigan, babalik po ang Radyo Klinika makalipas lamang ang ilang paalala.